Bedside report. Is it helpful or is it harmful? So what is bedside report and why does it matter? So bedside report is whenever nurses give report at the bedside. Giving report is something that all facilities do whenever the current shift is leaving and the oncoming shift is coming on for the day. They'll take the assignment that the new oncoming nurse is receiving and they will give report on the patients. This just means that they're giving information such as the patient's name, age, the reason that they came to the hospital, their past medical history, medications that may be due or medications that were given previously, any new or changing conditions in the patient, and just overall any pertinent information that the new oncoming nurse needs to take care of the patient for that shift. So bedside report essentially is when they take the report and they take it into the patient's room at the bedside. By doing this, they are allowing the patient and patient's family members to be involved. So of course this is focused on patient-centered care, and it allows the patient to feel like they are a part of the care that they are receiving. So is it helpful or is it harmful? So bedside shift report has many pros. It has a few cons, but for the most part, the pros outweigh the cons in this type of situation. So as stated earlier, this is a patient-centered care QSIN competency. And so you might be wondering why bedside report is considered a patient-centered care QSIN competency. And again, like I said, you're just taking the patient and you're involving the patient in the care that they're receiving. And when you look at patient-centered care, you are individualizing your care for that patient and you're doing what's best for the patient instead of yourself. Now, in some instances, it might be easier for the nurses to give report somewhere else, such as at the nurse's station, in the conference room, maybe in the cubby where they are able to chart for the day or for the night. It may be easier to do report there. However, you're not involving the patient, and the patient may feel excluded from the care that they receive. So that's why this is patient-centered care, because you're doing what's in the patient's best interest, not what's in the nurse's best interest. So as this diagram shows, again, just like I said, with patient-centered care, you're just giving individualized care to that patient. The same would go for a multitude of different diagnoses. You're not going to treat all asthma patients the same or all patients who have a broken leg. I mean, there's several things that you'll do similar, but you're not going to do everything the exact same, and that's essentially what we're doing with bedside report. So how is bedside shift report significant to nursing? So in the article, Moving Shift Report to the Bedside, an Evidence-Based Quality Improvement Project, we learned that bedside shift report can lead to a decrease in falls and an increase in how the patients feel about their care. So on this first bullet point, it says that bedside shift report is a great tool for decreasing mortality within the hospital. Well, it goes without saying, if you have decreased your falls, then you're going to decrease mortality. Now, of course, some patients, when they fall, they may suffer minor bruising, minor aches, but other patients, they might suffer something more fatal. They might fall and they hit their head, and they might get some form of a subdermal hematoma and be transitioned to an ICU. And of course, we don't want that to happen for anybody's sake. So another way that bedside shift report can be significant to the nursing profession is that nurses may have an easier transition into their shift. Now, what I mean by that is that the nurse will be able, before her shift starts, to go into each patient's room. The patients will be identified, and the nurse will be able to address themselves and introduce themselves to the patient, and they might then be able to find out how to prioritize who they see first. It's hard to know who to see first if you haven't laid eyes on anybody. So by doing bedside shift report, the nurse is coming in and finding out if that patient is having an issue. And I will talk more about this whenever I look at my individualized case example for bedside shift report. So as I stated earlier, patients are involved in their care, which can improve their overall experience at the hospital. And so this is greatly significant to nursing because, if these patients feel like they've had a better experience, they're going to treat their nurses kindly, and they're going to just feel better, and it will allow them hopefully to have a decreased hospital stay. How can bedside shift report be an issue? So one of the articles I found called Bedside Shift Report Implications for Patient Safety and Quality of Care, it's highlighted that if report is done outside of the room versus inside of the room, the patient feels lonely and left out of the care that is being given to the patient. So I have a picture on the next slide, just a little comic, but it shows that there are nurses who are giving report, but they're just standing on the outside of the room. So this article highlighted that those patients who didn't have report inside of the rooms, they just felt that they were being excluded, and they didn't feel like they were a part of the care that they were receiving. So they didn't feel like they had a voice in the type of care that they got. And of course, this can be an issue because it can cause the patients to feel, like they're not receiving what they need to receive, that they don't have a voice, and that is not true by any means. That is not true at all, because the patients are very much involved in the care that they receive, and they should have a voice and they should have a say in what they want done. So that's another reason why we should be looking at the idea of doing bedside report, because then our patients will feel like they have a voice. So another way that this can be an issue is say the patient has come in and they don't want their family to know how they came in, or they don't want their family to know that they tested positive for something, or they were diagnosed with something. Maybe they don't want them to know yet, or they just don't feel comfortable with that person in the room knowing. So if you go in to give report at the bedside, you have the possibility of potentially breaking their confidentiality and giving away information. So of course, that's another thing to keep in the back of your mind whenever you are doing bedside shift report. I think it's best if you go into the patient's room and you're talking to them. You always want to say, this is your oncoming nurse. I know you have family or loved ones of some kind in your room. We can ask them to step out, or if you don't feel comfortable with us giving this information, then we can do it outside of the room. So that's one way to avoid this issue. And then another way that this could be an issue, bedside shift report, is that you're giving away information that should have come from the doctor. Typically, this won't happen as often as the other issues, but it still could happen. So you just need to be mindful of knowing what the doctor has or hasn't told the patient yet, and just keep a good communication up with the doctors or the nurse practitioners or PAs taking care of that patient. So this is the comic I was talking about. The manager is saying, oh, they always give bedside report. However, they're just standing on the outside of the room, and then they go back to being on their cell phone and eating. So that's obviously not what we want as a bedside shift report, just because that's not actually bedside shift report. So an overall review of the literatures is essentially positive. There's very few negative things to say about bedside shift report, but they're mainly all positive and say that it is appropriate and it is the best course to take. The article, Implementing Bedside Shift Report, Walking the Walk and Talking the Talk, we learn, again, literature is positive, and we learn that sentinel events are decreased when report is done at the bedside. So sentinel events are things that could have been prevented, which that would be a fall or a patient death. So when you're going into these rooms and you're doing your shift report, you're looking to see if your patient's bed alarm is on, and there are a multitude of reasons for their bed alarm to have been turned off. So you're going in, you're looking, and say somebody got them up to the bathroom and didn't turn their bed alarm back on. Well, when you go in there, you'll see that, and you can turn the bed alarm on. Or they might have none of their side rails up, and they always need to have at least 2 of their rails up, so you can always check on that. Or when you go in there, the patient might be experiencing extreme pain, or they might be in respiratory distress and they might need something, and by going in and doing your report, you're able to take care of those needs as you would. So the best nursing practice, again, is to continue to use bedside shift report. It can be done to maintain the patient's privacy. You can continue to have a good flow of shift report and still allow the nurses to debrief. One of the articles stated that a lot of the nurses felt like when they did bedside shift report, they weren't able to debrief after a shift. So there could be designated areas after the nurses give report to meet, maybe in a conference room or maybe in their lounge. They can meet to debrief with the nurses that are coming on to shift. That way they can let out their frustrations, and they're not doing it in front of the patient, but they're doing it in a private area that is safe for them. Education regarding bedside report. So my SpongeBob picture over here says he's holding up a piece of paper that says bedside shift report saves lives, and then he burns it. So unfortunately, a lot of nurses who actually are, taking care of patients at the bedside, unfortunately feel this way about bedside shift report. I'm not sure if it's just because of lack of education or if they're just afraid of the change or afraid of what it's going to take to have to do bedside shift report. But overall, a lot of them say that it is a positive thing, but they still don't want to do bedside shift report. So education should be aimed at encouraging the nurses, and it should be informative on how it can help patients and how it can help the hospital and how it can help the nurses. The article that I had found that did an actual study on this was called Moving Shift Report to the Bedside, an Evidence-Based Quality Improvement Project. So it was a hospital, and they took 2 different units, but they didn't say what units they were, but they took the 2 different units, and one unit received 2 journal articles to review that went over bedside shift report, and they watched a video on shift report. So after they did that, they were then given a script on how to do bedside shift report. The other unit, they only received the script. They didn't receive anything else. So the one unit that did receive education, they had a 24% decrease in falls and a 12% increase in HCAP scores. So I think that goes without saying that definitely bedside shift report is a positive thing if it is educated and given properly. How can this further be studied and researched? So again, like I said, I think it goes without saying that it's a very positive thing, but there needs to be more studies done with nurses to show that it is a positive and it is a good thing. And I think the best way to do that is with an evidence-based practice research article. It was very hard for me to find any. I only found the one that was actual research. The rest was just review of literature. So for my case example, we had a patient who was given an opioid analgesic on the shift prior, but it wasn't given by the nurse that was taking care of that patient. The nurse that was taking care of that patient had a rapid response on one of her other patients, and when the patient called for pain medication, another nurse went and pulled the medicine and gave it. Well, unfortunately, she didn't check when the previous pain medication had been given, and so the patient received 2 opioids too close together and received a benzodiazepine. So with these 2 drugs, or with really the 3 drugs put together, the patient started to experience extreme respiratory depression. When we went into the patient's room to check on them to do our bedside shift report, the patient was breathing about 4 breaths a minute, would not respond to stimuli. My preceptor tried to do a sternal rub on the patient still wouldn't wake up then, so we ended up having to give the patient Narcan. So thankfully, we were able, when we did shift report, when we walked in to see the patient, we saw that if we wouldn't have done bedside shift report, then who knows if that patient would have been the last one on the list for us to see, because we had 4 other patients to see. So I'm very thankful that we were doing bedside shift report that day and every day that we were there, because otherwise that patient, I don't know something bad could have ended up happening to that patient. So in conclusion, like I've been saying, there are hindrances and negative outcomes of bedside shift report, but the benefits definitely outweigh the consequences in this case. Patients feel more involved in their care whenever bedside shift report is implemented, and sentinel events, medication errors, and falls are decreased with bedside shift report. So I think that this is something that should be implemented more and reinforced at hospitals more than it is now. And here are my references.